Good day, everyone, and welcome. Welcome to Ready, Set, Go, a webinar series which is sponsored by HUD's Office of Special Needs Assistance Programs, also known as SNAP. My name is Tony Gallo. I work for ICF International, which is one of the SNAP's national TA providers, and I will serve as the moderator of our webinar. The Ready, Set, Go webinar series, and SET in this case, is an acronym which stands for SNAP's E-Learning Tuesdays, will be held every Tuesday at 3:30 p.m. The Ready, Set, Go webinar series will provide valuable information and insights for continuums of care, HMIS administrators, grantees, project sponsors, and other stakeholders on a variety of topics on community planning, capacity building, etc. So on behalf of SNAP, I would like to thank you all for joining us. Today's webinar is called Preparing for Your 2012 Housing Inventory and Point-in-Time Counts. And we are very lucky with us to have the following national experts who will be presenting and providing resource guidance. The first presenter is William Snow of SNAP. The second, Lauren Dutton of Apt Associates, Molly McEvely of Apt Associates, and Tom Albanese of Apt Associates. Lauren Dutton is a senior analyst at Apt Associates. She's a member of the HMIS Technical Assistance team and has been for the past 4 years, and she provides point-in-time technical assistance and develops PIT count training materials. She manages the data collection process for the Homelessness Pulse Project. She's part of the data collection team for the annual Homeless Assessment Report, or HARP, and she works on a variety of affordable housing and homelessness projects and evaluations. The second presenter, Molly McEvely, joined Apt Associates as a senior analyst last February. Since joining Apt, she's worked on the next revision of the HMIS data standards, the VA HMIS integration project, and several other technical assistance projects related to HMIS. She's currently a task lead for the management of the Homelessness Data Exchange, or HDX, and the Housing Inventory Count, or HIC Guidance and Training. And prior to that, she was heavily involved with the development of a homegrown HMIS application as a programmer analyst, project manager, etc. Our third presenter is William Snow, who was hired as a Presidential Management Fellow at HUD in 2010. Since joining HUD, Mr. Snow has worked closely to analyze HUD's homeless data sources to learn how to make data systems more efficient and use the data to help stakeholders understand the nature of homelessness better and to help them prevent homelessness by strengthening their programs. And Mr. Snow is the desk officer for the Portland and Buffalo field offices. Tom Albanese probably needs no introduction. He is, of course, he provides consulting and technical assistance services as an associate with Apt Associates. Tom has provided planning, development, implementation, and management support for housing and homeless programs since 1992. And he's currently a lead provider of TA for the Federal Homelessness Prevention and Rapid Rehousing Program, or HPRP. He previously served as the Director of Programs and Planning for the Community Shelter Board in Columbus, Ohio, and was responsible for homeless and housing program research, development, and TA. So, next slide, please. Before we get started with the presentation, I just want to make a couple of logistical announcements. First off, today's webinar will last 1 hour. It is being recorded. The webinar recording and PowerPoint presentation will be posted next week on the HUD Homelessness Resource Exchange, or HRE, at www.hudhre.info. Currently, we have close to 800 participants that are registered for this webinar, and because of the large size of the audience, all attendees will remain on mute for the duration of the webcast. All of your content questions are very important to us, but because of the short time frame that we have, We won't have time to answer questions live. However, please submit questions to HUD's virtual help desk at the web address shown on your screen. Poll questions will be asked during the webinar to get your feedback on the information presented. Your responses will help give us a sense of how the webinar is going, and this will be interspersed throughout the presentation today. Again, you will remain muted throughout the call. You may submit any questions, concerns, or technical issues that you're experiencing via the GoToWebinar Questions dialog box on your screen. Note, again, we won't be able to get to all of your questions today, but if you don't get your questions answered, please submit them to the HRE. Materials referenced during this webinar will be available on the HUD HRE within a week of this presentation. And after the webinar, please take a moment to access and complete a very brief satisfaction survey so you can let us know how we did today. And we will provide you with the link on the last page of this presentation, and it will also be emailed to you. So with that, I'd like to turn it over to William Snow.
Thanks, Tony. It's my privilege to be here today. I'm thrilled to be able to be a participant in this 2012 HICPIT webinar. The HIC and PIT is near and dear to my heart. I've worked on it for a couple of years. The HIC and PIT data is extremely important to us at HUD, and it's always, for the whole time I've worked on it, been my privilege to understand the importance of it, and also I'm happy to be here today to share with you some of our changes and requirements for the 2012 HICPIT Count. Before we discuss the material, I do want to let you know that we have just published the 2012 HICPIT Guidance on the HUD HRE website. It's the first document if you use the Browse Product by Type dropdown on the home page and select HUD Guidance. We'll also send a listserv announcing the availability of this guidance as well. As a reminder, we at HUD will from time to time publish updates to this guidance. We're currently even looking at a change now that might have to occur after some decisions are made. So please remember to pay attention to listserv messages that reference changes to the HICPIT guidance and download the latest version of the guidance. To help you see any changes that we make, we're planning on publishing the updated guidance with the Track Changes feature so that you can navigate to the changes fairly quickly. All right, for today's webinar, we have 3 core objectives. The first is to highlight what the new or different HIC and PIT requirements are for the 2012 count. Second, to identify what data are needed to produce the HIC and PIT. And third, to discuss how to prepare for the HIC and PIT. Next slide, please. To start off, I want to briefly review what the HIC and PIT are. The HIC, or Housing Inventory Count, is a report that provides HUD with information needed to understand the capacity to house persons who are homeless at local and national levels. The PIT, or Point-in-Time Count, provides HUD with data needed to understand the number and characteristics of persons who are homeless at one point in time. Together, the HIC and PIT paint a picture of the supply of housing beds and units for the homeless community and the demand for that supply or inventory. This data allows us to look at local, state, regional, and national levels to discern the housing needs of homeless populations across the country and whether we, as a homeless assistance community, are able to meet these needs. As we discuss the details of the HIC and PIT in this webinar, I'd invite you to remember that we at HUD do not merely collect this data to inflict another reporting requirement on you. Rather, we use this data as a powerful tool for understanding the homeless situation in this country at micro and macro levels and the resources we have to fight this issue. We encourage you also to use this data to inform your decisions and discussions of who you are serving and how to best allocate your scarce homeless assistance resources to best serve your homeless community. We want to thank you up front for your worthy and diligent efforts and look forward to continuing this great effort. Next slide, please. COC's will report, or I want to go over some changes to the HIC requirements as well as the PIT requirements for the 2012 count. In the past, COCs have reported their HIC data according to two household types, households with children and households without children. Starting in 2012, COCs will report their HIC data according to three household types, households with at least one adult and one child, households without children, and households with only children. Thus, the former category, households with children, has been parsed into two household categories, which are households with at least one adult and one child, and households with only children. We've done this in order to help us better understand the nature of family and child homelessness and to align our reporting requirements with other data reporting requirements such as the PIT and the Annual Performance Report, or the APR, which currently use these three household categories. An additional change, HUD has designated VA domiciliary or VA DOM beds and units as emergency shelters in the past. Beginning in 2012, the VA DOM beds will be reported under the Transitional Housing Program type. Next slide, please. In previous years, HUD has required COCs to perform a sheltered and an unsheltered count at least every other year. Starting in 2012, HUD is requiring COCs to conduct their sheltered counts annually. However, we will still only require COCs to perform their unsheltered counts every other year. We also encourage communities to use their HMIS to generate their sheltered counts if appropriate. Next slide, please. One of the many purposes of the HIC and PIT is to provide stakeholders, including HUD, a single snapshot at a given point in time of a homeless assistance community's supply of housing inventory and demand for that inventory. Coordination between the HIC and PIT data is critical. To help ensure consistency in the data, COCs should be conducting their housing inventory and sheltered point-in-time count of homeless persons on the same night. Again, we can't reiterate that enough. Please coordinate your counts so that your HIC and PIT count occur on the same night. Thus, the summation of the data that's reported under the PIT count section of the HIC will be in the program types, emergency shelter, transitional housing, and safe haven, will be consistent with your point-in-time counts, which basically count the emergency shelter, transitional housing, and safe haven persons who are in shelter. So one other thing to keep in mind is the importance of working within your COCs to execute an effective HIC and PIT count. Next slide, please. We are now coming to our first poll question. For those who are unfamiliar with how to use the poll feature, a question is presented on your screen, and you have the ability to answer that question on your screen. We'll give you 30 to 40 seconds to answer this question. Will all COCs be required to conduct a sheltered PIT count in 2012? Yes or no? All right, so the results are in. As is the general answer, the answer is yes. Starting in 2012, COCs will be required to conduct an annual sheltered point-in-time count. So thank you for your responses. I want to turn the time now over to Molly to discuss the HIC guidance. Next slide, please.
Thank you very much, William. I am also very happy to be here. And before I get into the specifics of the housing inventory count, I would like to take a minute to talk about the term, the night of the count, and what exactly it means. As William mentioned, the HIC and the PIT should be conducted on the same night, and perhaps it goes without saying that all the parts of the PIT should be conducted on the same night. There is no unsheltered count required for 2012, although the data is always welcome, and you can enter unsheltered numbers in any year. But very often, unsheltered counts are conducted at times that might appropriately be referred to as the middle of the night. But technically speaking, they could also correctly be referred to as the very early hours of the morning. And before you send a group of people out at 3 o'clock in the morning in January, you are going to want to be very clear about which morning falls in the middle of the night that you have identified. So I looked up night in the dictionary, and because it was consistent with HUD's understanding and use of the term, I included the definition on this slide. It is the period of darkness between sunset and sunrise. As a data person, I find this somewhat inconvenient because it covers 2 dates and it's somewhat imprecise. But if you look at the illustration here, the night of the count begins at sunset on the date of the count, on the date that you identify as the date of your count. And it ends at sunrise the next morning. So if you identify the night of your count or the date of your count as, for example, January 25th, and you have people going out to collect information about unsheltered homeless persons who are homeless, they're actually going to be going out at 3 or 4 o'clock on the following morning, on the morning of the 26th. So the night of the count begins at sunset on the date that you select for your count, and it ends at sunrise on the following day. Next slide. You might say that one goal of HMIS is to capture data that describes a COC, its components, and the people who are served by that COC. The PIT and the HIC and HMIS data are all fundamentally related. And the HIC is a snapshot of housing for persons who are homeless in your COC on one day. So the data components involved in putting the HIC together are the same components that make up a COC. Next slide. As you are determining which programs to include on your housing inventory count, you should include residential COC programs in the following 5 program types: emergency shelters, transitional housing, rapid rehousing beds in HPRP programs, and we'll get into the very exact specifics of how to count those at a later point, safe havens, and permanent supportive housing. You should only include beds and units that are dedicated for persons who are homeless. A program that incidentally serves homeless people should not be included in your housing inventory count. Next slide. You should remember to include housing programs for the homeless that are funded by the U.S. Department of Veterans Affairs, faith-based organizations, and other private and public funding sources. If you have questions about how to incorporate VA programs into your housing inventory count, you might want to register for next week's Ready, Set, Go webinar, which is called Preparing for Your 2012 HIC and PIT Counts with a special attention on veteran program guidance. And we'll talk about the naming conventions of setting up VA programs and how to categorize the various types of VA programs. Next slide. According to HUD's HMIS data standards, which were last published in March of 2010, all homeless assistance and homelessness prevention programs that are part of the COC's homeless system must have program descriptor data recorded in the COC's HMIS. Program descriptor data recorded in HMIS should be used to complete the HIC, and it must match the HIC data recorded by the COC. In some cases, this may not be possible, but that is the goal. It is also true that not all elements of the HIC can be derived from HMIS. We'll see later that there is a question about whether or not a program receives funding under the McKinney-Vento Act, and whether or not beds serve households composed of only children. That information was not included in the March 2010 data standards, and information may have to come for those two components from other sources. Next slide. So the data building blocks of the HIC, the building blocks of a COC, the largest and most basic component is the organization. Every program in your COC belongs to an organization. An organization may have one or many programs. And the only information that you need about the organization for the HIC is the name of the organization. Next slide. The second level is the program level. An organization may have many programs. When you enter the organization name, it should be the same for each of the programs, for each of the organization's multiple programs. And for the data elements listed at this level, program name, program type, geocode, target population A, which is optional, target population B, and McKinney-Vento funded, you should have one and only one value for each of these elements on your HIC. A program has only one name. You might refer to it by lots of different names, but when you're entering it into your HIC, we only care about one. Nicknames aren't relevant here. A program has only one type. If you have an organization that operates an emergency shelter program and operates a transitional housing program, those are two separate programs. A single program is emergency shelter, or it's transitional housing, or it's safe haven. It is not more than one type. A single geocode, a single target population A, if there is one, and target population B. The definition for these categories are that the program serves more than 75% of the people identified in the target population. So in order to, you can only have one. And then the question that we mentioned earlier about whether or not a program receives McKinney-Vento funding. Next slide. The next level is the bed and unit inventory information. The household type that the beds and units are intended to serve, the type of bed, when the beds and units are available, the number of beds and units, how many beds and units there are for chronically homeless individuals or families for permanent supportive housing programs only, the unit inventory, the inventory start date, the inventory end date, the number of beds that are participating in HMIS, the date that the beds began participating in HMIS, and if that participation has come to an end, the last date on which they entered data, and then the inventory type. So as you are thinking about preparing for the 2012 HIC, check your HMIS. Can you enter this information? If you cannot, check with your HMIS administrator. If you are your HMIS administrator and you don't know the question, check the answer to the question, check with your vendor. If you can enter this information, have you entered it? Is it current? Does it accurately reflect the programs, the bed and units that make up those programs in your COC? Next slide. And in the next few slides, we're going to talk in detail about some of the data elements in the bed and unit inventory information. In 2011, you identified bed and units by whether they were reserved for households with children or households without children. In 2012, we're going to look at, are the beds and units reserved for households with at least one adult and one child, households with only children, or households without children. These household types are consistent with the household types on the PIT and those that are recorded on the APR. The new household type or division, households with children, has been divided into households with at least one adult and one child and households that are made up of only children. Unaccompanied children, a minor parent with a child, or any other combination of people under 18. Those should be counted in the category of households with only children. The March 2010 HMIS data standards do not include a response category for households with only children for the relevant data element here. So information about the number of beds and units that are designated for that household type will have to come in 2012 from an alternate source. If you are identifying inventory as being designated for households with only children, you should take care to make sure that the inventory is included only in that category and not in the category for households with at least one adult and one child as well. Next slide. If one or more of your programs serve multiple household types and do not have a specific number of beds designated exclusively for a single type, they'll serve whoever shows up. You can designate the total number of beds into the different household categories based on one of two methods. The first method is consistent with the instructions in the data standards for entering this information into HMIS, and that is to divide the beds based on their average utilization. If, in general, you have about 60% households with at least one adult and one child, and about 40% households without children, and you have 100 beds, you would assign 60 beds to the one, 40 beds to the other. The other option is to divide the beds based on the usage, on your usage on the night of the count. And this is consistent with previous HIC guidance. HUD recognizes that there is a little bit of a disconnect between the housing inventory count instructions and the data standards, and until those are brought in line with one another, you'll be able to choose the methodology that you use. We do ask that you choose a single methodology and apply it consistently for all of the programs in your COC. Next slide. When we ask you to identify the bed type for emergency shelter, the categories there are facility-based, voucher, and other. Facility-based are beds that are located in a residential homeless facility. They're beds that are intended for use by homeless people. Voucher beds are beds in a hotel or motel that are paid for by the program but are not located at the program. And then other beds are beds that might be located in a church or another facility that is not designated for use by homeless persons, but are being used for homeless persons under the auspices of the program on the night of the count or in general. Next slide. When we talk about availability, there are 3 categories of availability. The first is year-round, and you'll notice that there's no definition for year-round. Year-round beds and units are available on a year-round basis. That is not to say that when you enter these beds into your housing inventory count that you are guaranteeing 100%, promising your firstborn that those beds will be available 365 days a year. It means that they're not seasonal beds. Seasonal beds are beds that are on a planned basis brought into the housing inventory of a COC to deal with times of particularly high demand, like winter. There's a set start date, there's a set end date. A seasonal bed is planned, but it's not available year-round. And year-round beds are not overflow beds, which are available on an ad hoc basis during the year when demand exceeds the planned bed capacity. And an example of an overflow bed might be if an emergency shelter has a stack of mats in a closet, they can tap into when all their beds are full on particularly high demand nights. Overflow beds differ from seasonal beds in that they are used as needed, but they aren't used consistently unless other beds are full. Next slide. So when we are talking about bed and unit inventory on the HIC, we are almost always talking about the number of available beds that were available on the night of the count, regardless of whether or not there was anyone sleeping in them. There are, as there always are, exceptions to this. Beds that are under development are, by definition, not available on the night of the count. So in counting the number of beds that are under development, you would count the number that are planned for, that will be available. When you're counting overflow, you're counting the number of occupied beds. You don't want to say, well, I have 75 mats in my closet, so on the night of the HIC, I had 75 overflow beds. If there was nobody sleeping on a mat, you would indicate 0 overflow beds. And then the HPRP rapid rehousing beds. Similar to overflow, this is going to count the number of occupied beds, or more exactly, the number of people who were literally homeless at the time of program entry, are receiving HPRP assistance, financial assistance, or housing relocation and stabilization services, and are occupying conventional housing. You may have people who are participating in an HPRP program but are residing in an emergency shelter or transitional housing. You do not want to count those people in the housing inventory count, or you do not want to count those people as occupying HPRP RRH beds on the night of the count. So in order to count a bed, you must have a person who was literally homeless at the time of program entry, who is receiving HPRP assistance, and who is occupying conventional housing. Next slide. Programs with a fixed number of units but no fixed number of beds may estimate beds by multiplying the number of units by the average household size. So if you have 10 units for households with at least one adult and one child, and the average household size of the program is 3, you could enter 30 beds for households with at least one adult and one child. If your average household size is 2.7, enter 27 beds for households with at least one adult and one child. Next slide. Inventory type refers to beds or vouchers, to current inventory, or beds or vouchers that are available on the night of the count and are not new since the last housing inventory count. New beds or vouchers are beds or vouchers that represent an increase in capacity since the last housing inventory count. So if I have a program and I have 2 units and they each have 4 beds on my last housing inventory count, but the one unit was really in pretty bad shape and we had to close it down, so that brought us down to 4 beds. But then we put on an addition with 2 more units, and they each had 4 beds. So this year, I have 3 units with 4 beds each, and last year, I had 2 units with 4 beds each. Even though 8 of those beds might actually be shiny and new, what we're looking for here is an increase in capacity. So you would have 8 current beds, because that's, you had 8 last year and you have 12 this year, so the number from last year is what's current, and then 4 new beds that represent an increase in the capacity of the program since the last housing inventory count. And then beds that are under development are beds that are fully funded but not yet available at the time of the housing inventory count. Next slide. Before I ask anyone to answer this question, I would like to assure you that no one from HUD will ever see your response. The point of the question is to get a sense of how things are actually happening at the COC level and not to produce a hit list. So the question is, does your COC maintain program descriptor data elements in HMIS? The responses are yes, and we use HMIS to produce some or all of the HIC. Yes, but we produce the HIC by other means. We could enter them, but we don't, or they're not up to date. Our HMIS cannot store all program descriptor data, and I don't know. And those results are pretty promising, actually. So about half said that, yes, the COC can collect, does collect, and the program descriptor data elements in HMIS and uses them to produce some or all of the HIC. For those of you who indicated that your HMIS can't store all program descriptor data, check again with your HMIS administrator or with your vendor. For those of you who have the data but produce the HIC by other means, consider using HMIS. The final component of the housing inventory count, the one that we haven't talked about yet, is the point-in-time count for each program. Lauren Dunton is the point-in-time count expert, so for that last part of the HIC, I am going to turn the webinar over to Lauren. She'll talk about the PIT count and then the point-in-time count report.
Great. Thanks, Molly. Okay, so like last year, all programs reported on the HIC are required to report a total unduplicated number of people that are served in that program on the night of the count. So this is for all programs, emergency shelter, transitional housing, safe havens, permanent supportive housing. And as the graphic illustrates, the total number of people reported in these programs on the HIC should be equal to the number of people that are reported in the point-in-time sheltered count. The only difference would be that obviously the permanent supportive housing programs are not reported in the point-in-time shelter count. So it would be the total of the emergency shelter, safe haven, and transitional housing programs would be equal to the point-in-time sheltered count. Next slide. So now we're going to get into the point-in-time guidance itself. As William mentioned earlier in the presentation, beginning in 2012, COCs are going to be required to conduct an annual shelter count to capture the total unduplicated count of homeless persons. The shelter point-in-time count should be completed using statistically reliable unduplicated counts of homeless persons. COCs with sufficient data quality in their HMIS are encouraged to use their HMIS to generate their shelter counts when possible. You're already doing essentially a shelter count in 2012 for the housing inventory count. So if you're using your HMIS to generate your housing inventory count, it should also, you should be able to pretty easily pull those numbers and have them reported for the required sheltered count. Again, as William said, the unsheltered count is going to be optional in 2012, but it will still be required every other year with the odd years required. So 2013 will be the next year to have a required unsheltered count. If you are not conducting, some COCs choose to do an unsheltered count every year, although it's not required. But if you choose not to do an unsheltered count in 2012, HUD will be using your 2011 unsheltered data for reporting purposes. Next slide. So the specifics data that you're reporting for the point in time hasn't really changed from last year. This slide covers the population data that you're supposed to be reporting. You're going to report the total number of persons and households for each of the 3 household types. Persons in households with at least 1 adult and 1 child. Persons in households without children. And persons in households with only children. Again, this is now going to align with the same household types that are going to be recorded in the housing inventory count. Next slide. And again, the subpopulation data is going to be pretty much the same as last year. You're going to be required to collect the total number of sheltered and unsheltered people in each of these subpopulations. Chronically homeless individuals, chronically homeless families, and in that category you're going to need to count the total number of persons in chronically homeless households, as well as the number of sheltered and unsheltered veterans. Just something to highlight here is that it's really important that you make sure that you're using HUD's definition of chronically homeless when you're determining the number of chronically homeless individuals, as well as the number of chronically homeless families. HUD's definition states that people 18 years of age or older with a disabling condition who have either been continuously homeless for a year or more, or have had at least 4 episodes of homelessness in the past 3 years, and then are either living in a place not meant for human habitation, or are in an emergency shelter or a safe haven, can be considered chronically homeless. Children cannot be considered chronically homeless, though children can be part of a chronically homeless family. And people living in transitional housing programs at the time of the point in time also cannot be considered chronically homeless. Next slide. Okay, and there are several subpopulation data categories that you are only required to collect the total number of sheltered persons in each subpopulation. You can always report the number of unsheltered if you do collect data on that, but it is not required by HUD. The categories where you're required to have data for sheltered subpopulations include the severely mentally ill, those with chronic substance abuse problems, persons with HIV or AIDS, victims of domestic violence, and unaccompanied children. So those people under 18, ages 17 and under. Again, this is the same as last year, so it shouldn't be any surprises there. Next slide. Okay, so often we get questions about who should be included in the point-in-time count. In the sheltered category, you should include all persons who are sleeping in beds provided or funded by programs that are considered themselves emergency shelter, transitional housing, or safe havens. And again, those should be people staying in those programs on the night designated for the count. For the unsheltered point-in-time count, you should be counting all homeless persons who are on the street or in a place unfit for human habitation on the day of the count. Next slide. So then the question also often comes up to who does not get counted. So these on the slide we present people that should not be included in the point-in-time count. You should not include residents of permanent supportive housing programs. Remember, we went over earlier, we still, in the housing inventory count, will be required to report the number of people residing in each permanent supportive housing program on the night of the count, but those people should not be included in this point-in-time, separate point-in-time count. You should not be including persons who are staying in beds or units not dedicated to serve persons who are homeless. Often we get questions about people that may have come from homelessness and are staying in different types of programs that aren't dedicated for homelessness. Those people should not be included in the point-in-time count. You should not include people in your count who are staying with families or friends who are doubled up because they don't necessarily have a place of their own. You can often, some communities will collect information on this population for their own planning purposes, but you need to make sure that you can separate those people out for the purposes of submitting your data to HUD. Also, something to mention here is that if you are working with your local public school homeless liaison to help identify families that may be in homeless situations, you need to make sure that the homeless liaisons are using HUD's definition of homeless. Often they use the Department of Education definition, which includes those who are doubled up. So you want to make sure that you're collecting all information for HUD's point-in-time count based on HUD's definition of homelessness. The last major group of people that should not get counted in your point in time are people who are residing in their own unit with HPRP assistance. So that's HPRP rental assistance. That is part of the rapid rehousing or homeless prevention program. Next slide. So here are some links to resources as you are planning your 2012 HIC and PIT counts. There is, as William mentioned, recent guidance that HUD has released, and it's available on HUD HRE. The link is on your screen right now. We are also working currently to revise the guide to counting sheltered homeless people, and that will be released on HUD HRE probably sometime close to the end of the year. And then in the spring, we'll be working to do a pretty major revision to a guide to counting unsheltered homeless people. So look for listserv announcements and postings of that document on HRE as well. And as William mentioned, there will be probably some updates to the 2012 HIC and PIT guidance, so please stay tuned to the HUD homelessness listserv and check back on HRE to see if there are any updates to the 2012 guidance. Next slide. Okay, so that's the end of our formal presentation, and I'm going to hand it back over to Tony Gallo to finish up.
Thank you, Lauren. Thanks very much to all our panelists, Lauren Dutton, Molly McEvely, and William Snow, and thanks to our resource advisor, Tom Albanese, as well as to everyone for calling in and taking the time to attend this webinar. As a reminder, if you have questions that Tom was not able to answer during this webinar, please submit them through the virtual help desk. Also, this is a reminder that the webinar recording and PowerPoint presentation will be posted on the HUD HRE website within a week. Once again, please join us next week for a webinar called Preparing for Your 2012 Housing Inventory and Point-in-Time Count with special attention on Veteran Program Guidance. Before you get off this webinar, please note that, again, we would like you, if you could, to please complete a tiny satisfaction survey. You can copy this link down and paste it into your browser and then take the survey, or conversely, tomorrow you will receive an email with this link on it. So if you could do that for us, we'd really appreciate it. In the meantime, thank you very much again, and enjoy the rest of your day.